And then as you go through care with a patient and you've been in practice a number of years, we always have patients that don't respond the way that we want them to. We do a trial of care of about 4 to 6 visits, maybe 6 to 8 visits, and they don't respond. And so some of the reasons are a fundamental, which is the diagnosis is not correct. You think it's an SI joint and it's really a lumbar facet problem, and the activities of daily living modifications that you've given them in the home exercises and stretches are not for the right diagnosis. And so that is the number one thing that I see is doctor will think patient A or B has this going on where it's really coming from somewhere else. And you should be getting about every 3 to 6 visits, you should be getting some change in your subjective and objective findings with patients. And if you're not, you need to change up what you're doing. You need to reassess to figure out, is there another structure causing the problem? Or maybe the patient is doing something that you've asked them not to do away from the office, and they keep doing it, and they're not making any progress. The most important thing when it comes to exercises and stretches, number one, is it for the correct condition? And number two, are they doing it all? And all of us have had patients that lie to us and say, oh, I'm doing my home care, and then we feel their back and we know they're not doing their home care. So that may be a reason that they're not responding to care. Work and lifestyle factors, that's also a key component. If someone has a chronic disc issue and you've diagnosed it that way, and the history and exam are also there to justify that, but then they sit as a truck driver all day long, that's going to be something that needs to be in your complicating factors of care that may take longer. If the insurance company is going to authorize additional visits, that needs to be something that you can use to fight any denials of payment or any authorization of more treatment. And you need to put that down in there to make sure that you have that as ammunition if that kind of thing comes up. And the other thing that needs to come up in your assessment is the patient being consistent with their care plan? And if not, you need to document why.